Well, today at the ESC, I presented the results of the Pacific Stroke Trial, which is a phase 2 dose-ranging trial where patients with non-cardiovascular ischemic stroke presenting within 48 hours of symptom onset were randomized to either 3 doses of asundexian, 10, 20, and 50 milligrams daily, or matching placebo. And patients were treated for a total of 6 to 12 months. And we did not see a dose-dependent effect on our primary outcome of the composite of ischemic stroke or covert brain infarction on MRI. However, this was seemed to be driven largely by a lack of effect on the covert brain infarction component of our primary outcome, which was largely due to small vessel disease, and it is good biological plausibility as to why patients with small vessel disease may not respond to factor XI inhibition. Interestingly, though, in patients with a non-cardiovascular ischemic stroke, we did note that there was a suggestion of a dose-dependent effect of asundexian on the composite secondary post-hoc outcome of the ischemic stroke and TIA, and this reached a robust 35% relative risk reduction with asundexian 50 milligrams daily relative to placebo, and this was even more pronounced in patients who had underlying atherosclerotic disease. In subgroup of patients that had atherosclerotic disease identified on vascular imaging, the effect size was a 61% relative risk reduction for the composite outcome of ischemic stroke and TIA. Importantly, this occurred without an associated increase in major bleeding or intracranial bleeding with the asundexian treatment in this population. So overall, we think that these results are very exciting and promising to move on to a phase 3 trial that is adequately powered to validate these findings, and with the aim of establishing a new paradigm for secondary stroke prevention and hopefully addressing a major unmet need in this patient population.